As of June 6, 2014, Louisiana passed a law requiring CPR certification for high school students, meaning you couldn't graduate unless you're CPR certified. So most, if not all of you, should be CPR certified or may even need recertification soon. As far as certifications go, first aid certification is not mandatory in Louisiana high schools like the CPR one. On account of this, I'm sure there are many first aid skills unknown and known to you, so I am here to provide knowledge for one of the many skills. I will be sourcing American Heart Association's workbook so I can teach you how to properly splint. Splinting is the act of immobilizing the joints of an injured body part to decrease further injury and protect the wound until advanced training arrives and takes over. To start off with splinting, make sure the environment around you is safe. Upon doing this, get a first aid kit and apply PPEs. After applying PPEs, find and use an object to keep the arm from moving and or immobilize it. This could be towels, magazines, pieces of wood. I am using a magazine. These objects have to be longer than the injured area to be effective. If the body part is bleeding, apply pressure to the wound to stop the bleeding. Apply a dressing to the wound before you start to splint. And if applicable, leave bent and deformed body parts in their bent and deformed positions as you splint. And if the bone is coming through the skin, cover with a clean dressing and splint as needed. If the patient's other arm is uninjured, you can have them help you by having them hold up their own injured arm so you can secure it easier. You can even give them a cylinder-shaped object for the injured arm to secure their extremities, like this. After you cover up any broken skin with a clean or sterile cloth, tie or tape the splint to the injured area so you can support it. Use tape, gauze, or cloth to secure it, but don't put it too tight. I'm using cloth. Notice you have to put it on both joints to secure it. Ask the patient if they can move their fingers and if they can feel you brush your fingers along theirs. Lastly, keep the limb still until the patient can be seen by a healthcare provider. To do this, you must use a triangle bandage, a bandana, or a scarf, or any triangle cloth to secure the arm to the body. I am using a scarf. You tie the cloth behind the neck and make sure the arm is comfortable. And that is how you splint.